Hello, and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. With me today are the Minister of Health, the Honorable Terence Dayal Singh, the Minister of National Security, the Honorable Stuart Young, and the Chief Medical Officer, Dr. Roshan Parasram. The Minister of Health will now give us an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to Trinidad and Tobago, members of the media. As you can see, we are leading by example from this morning in wearing masks. The masks that I think three of us have on so far are homemade masks. And this is a very simple way to go to help save lives. This morning, I will give you a quick update before I get into three issues which I need to raise with the national community. As of 10 a.m. this morning, the world has recorded 1,363,123 cases, with 76,383 deaths. Trinidad and Tobago, we have samples tested to date, 870. Positive cases, 106. When we take away the anomaly of the cruise ship component of that, we are left with 57 for statistical reasons. Unfortunately, we have had 8 deaths to date with 1 discharge. Yesterday at the Diplomatic Center, I would have dealt exclusively and in great detail about our response to COVID-19 as far as ventilator and ICU capacity in Trinidad is concerned. Today, I now want to spend an equal amount of time talking about our Tobago response. It's one country, 5 RHAs, 1 response. In Tobago, we have 5 ventilators dedicated to COVID. With the help of Trinidad and Tobago's doctors, especially Dr. Anthony Parkinson, we have a dedicated COVID ICU at the Scarborough General Hospital. The old hospital, which goes up to Fort George, I believe, we are under the national plan. We have activated 2 wards with 24 beds that suspect cases can go to start their treatment. And according to the national plan, Tobago also has its own step-down facilities consisting of guest houses and hotels. So that's a national plan as far as ICU capacity is concerned, ventilator capacity, step-up and step-down facilities. And this is all under the direct control and management of Dr. Anthony Parkinson, who is an intensivist who is managing the national effort. Ladies and gentlemen, the Prime Minister has been urging the country to behave in a certain way. Since we started this COVID response back in January 30th with our first set of travel restrictions, the objective has always been and will always be to decrease the number of cases, decrease the number of deaths, so that we do not break the public health system. That's the overall objective. The strategy we are using to achieve that objective is a simple one: stay home. Simple one: stay home. To achieve that strategy and the ultimate objective, we have instituted a series of measures which, as Minister of Health, are signed off to achieve certain goals and aims on the ground. The regulations, therefore, have the backing of law under the Public Health Ordinance. To explain this, I will now ask for a particular graphic, which I hope you can get up on the screen, to explain this in very simple terms. This graphic just shows you how contagious a disease of COVID can be. You have one person at the top of the pyramid. One person who may be asymptomatic, who may be symptomatic and knows it, and decides to go out on the Brian Lara Promenade, Harris Promenade in San Fernando, the Esplanade in Tobago, the market in Point Fortin, the market in Chaguanas. You get the point I'm trying to make. It just takes one person to infect 2 people. 2 people then infect 6 people. 6 people then infect 8 people. And 8 people then infect 10 people. That's how the pyramid of contagion is created. It just starts off with one person who insists on being out in the public, who insists that they must exercise around the savannah or in Safe Park in Chaguanas, who insists that they must buy food on the street. Just takes one person. But if we multiply that by 10 people who are out in the public, you move from the pyramid base being 1 to 10 to 10 to 1,000. That is how fast this virus will spread. And that is what will break the public healthcare system. So we are hoping that in an effort to achieve the objective, which is to decrease the number of cases and deaths, so we don't break the public healthcare system, the strategy is to stay home. So if the first person at the top of that pyramid, which we just saw, stayed home, it means 10 people at the base of the pyramid will not be infected. And then those 10 people would not start their own individual pyramids of transmission and infectivity. And this is where the measures are coming in. These are not measures I think the Prime Minister and the government likes to impose, but it is a serious public health matter. The regulations, the updated regulations that was signed off yesterday, has one new feature, in Section 8. We want to encourage private labs to do testing. We want to encourage it. We are asking all private labs, once you have your PCR machines, to approach CARPHA for validation. The new regulations under Section 8 now puts a positive requirement, a positive duty of care on private labs who are certified by CARPHA to have a positive reporting obligation to report their results directly to the Chief Medical Officer and not to individuals. Because we have to have our database, we have to know who the positive cases are. Under the new regulations, any lab that does not conform to these regulations will be fined, unfortunately, $50,000 or 6 months imprisonment. We did not take this decision lightly, but it is taken in the national interest to do 2 things. 1, to ramp up testing. We want to partner with the private labs, but it has to be a partnership built on a memorandum of understanding that this is a reportable disease, this is a national effort, and we have to create a national database so that we could manage the disease. So that one person who may go to a private lab for testing does not create their own pyramid of infection. So those are the issues I wanted to raise with the public this morning. So Minister Cox, I thank you for the opportunity, and I now turn over to you.
Thank you very much, Minister Dayal Singh. Let us hear from the Chief Medical Officer, Dr. Roshan Parasram, who will provide us with a clinical update.
Good morning, Honorable Ministers, members of the viewing and listening public. So my clinical update as of the 7th of the 4th, 2020, as Minister would have indicated, there was one additional case, which is a case from Tobago, that is an imported case, would have been isolated from the onset. So as Minister alluded to the pyramid, there was, in that particular case, there's no pyramid of infection, and we are very happy for that. As we go into the cases at Cora, there are still 26 cases at Cora, all doing very well, awaiting their negatives in order that we can discharge them. In Couva, there's a total of 70 cases one ICU case that is not ventilated and is fairly stable, one high dependence, 3 persons in the high dependency unit, and the remaining 66 persons are doing very well. Quite a vast majority of them are now asymptomatic, awaiting their negative tests as well. And as I said yesterday, we have added 1 person to the transfer list, and now 15 people are waiting transfer out of that facility, and we will be doing that in the next couple of days once we identify and have ready a suitable place for decanting. In terms of the patients at Balandra, we still have the 22 persons there, and they're doing well as well. There's no additional symptoms that we picked up so far. So we're hoping that later on in the week, once everything goes well, we can discharge some of those persons as well. Thank you.
Thank you very much. The Minister of National Security will update us on the new measures announced by the Prime Minister yesterday.
Thank you very much, Minister Cox. Thank you very much, Minister Cox, Minister Diyal Singh, Dr. Parasram, viewing members of the public of Trinidad and Tobago, members of the media. Good morning. This morning I'd like to start on a personal note, today being 4 weeks since my mishap at the opening of a fire station in Penal 4 weeks ago. I never got the opportunity to publicly thank all of the well-wishers who have been sending me messages of encouragement and inquiring as to my health. I really appreciate it. Thank you all very much. Hopefully I'm on the road to a full recovery, and I have begun my physiotherapy, so I've gotten rid of the sling. So thank you all very much. The measures that we in the government continue to implement are measures, as we've taken great pains to point out, measures to protect the population here in Trinidad and Tobago over and over again. The watchwords remain, from our perspective, stay home, stay safe, stay alive. Having regard to that, as we've consistently told the population throughout, we continue to review on a daily basis and many times a day, along with the Ministry of Health, the Chief Medical Officer, and other medical experts, what are the measures that we need to take as a country under the direction and the leadership of the Prime Minister. As a result of that, after very careful and long consultation over the weekend, the Prime Minister announced yesterday, at yesterday's media conference, certain measures that were implemented into law last night, late last night, with the assistance of the Attorney General and the legal drafts people. And that is now known as number 8 regulation. And I just like to use the opportunity here today to just briefly go through some of the new measures that we've implemented and provide some explanation, because as is usual with respect to these measures, every time we change it, we get a number of inquiries as to the application of these measures. I have implemented, as of Sunday, every single morning I meet with the heads of security, the Commissioner of Police, the Chief of Defence Force, the head of the National Operations Fusion Center or Intelligence Services, and every day we have a daily briefing and a reporting exercise and the feedback, so that we know how better to implement and to enforce some of these measures. But again, I use the opportunity to just plead with you, please don't let it come down to enforcement by the Trinidad and Tobago Police Service. These measures are all driven by our health experts and the advice that they give us, and they are all designed to try and keep Trinidad and Tobago safe in this time of global pandemic. The first thing is worth repeating, that with respect to public gatherings, we continue to ask that only persons who absolutely have to go out to work and work as essential workers in essential businesses should, and then us, the regular members of the public, only go out of our homes if we need to make absolutely necessary trips. We go straight there, get what you need to get at a supermarket, a grocery, a pharmacy, health institution, and get right back at home as quickly as possible. Gatherings in public places remain, that we don't want persons exceeding 5, except at essential businesses. The new measures that we've sought to implement, there's one that's worth just pointing to, because it hasn't been found any focus over the last couple of weeks. Social workers and workers who provide social welfare support, non-governmental organizations that work with the socially disadvantaged and vulnerable, are categorized as essential workers, especially in a time like this when are vulnerable due to some of the measures being taken to protect the population, are directly affected. This special category of workers become, along with our health workers, our law enforcement workers, and other essential workers, some of our frontline workers, and we thank them for what they're doing. Manufacturers and distributors of food, beverages, pharmaceuticals. We have taken a specific measure that I'll get to in a short while. Of course, the manufacturing of food, beverages, pharmaceuticals can continue unimpeded, as that is necessary for us to get to our population. However, the delivery of these items we have curtailed, and we're asking for the deliveries to stop at 4 p.m. on a daily basis. We've been asked questions after yesterday's press conference. They continued with respect to fishermen. Fishermen were always declared essential workers in this time. One point we'd like to make from a national security perspective with respect to our fishermen: our borders are closed. Our borders don't only include our airspace, but they also include our maritime borders. So we know that there are certain fishermen who are going across the maritime borders, and they may not be actually conducting fishing exercises. We had our first sting operation on that over the weekend, and we picked up some persons posing as fishermen, going across the border to trade in certain items. They are going to be charged under these regulations and subject to the full brunt of the law. Please stay within our borders. You may continue your fishing within our sea borders and sell our fish, as I said yesterday, in accordance with proper social distancing and public health measures. The regulations that we have implemented as of last night, when it comes to licenses of persons who are licensed to sell alcohol: the holder of a spirit retailer license, a wine retailer license, a restaurant license, or a wine merchant's license under the Liquor Licensing Act shall ensure that their premises are closed for business until the 30th of April. So those licenses, I'm still being messaged and asked by persons who have liquor marts and these types of licenses if they can continue selling alcohol, even though they may have, for example, cheese and crackers, chewing gum, and other items in their stores. The answer is no. Understand that the measure and the policy behind all of these regulations is to keep people at home. Stay at home, stay safe, stay alive. So spirit retailer licenses, wine retailer licenses, restaurant licenses, or wine merchants licenses under the Liquor License Act, your premises with respect to such licenses are to be closed for operation until the 30th of April. This does not apply to discount stores, markets, and supermarkets. For the avoidance of any doubt, and I'm quoting directly from the regulation that we sat down and worked out with the Attorney General, the Commissioner of Police, and others on the guidance of the Ministry of Health. For the avoidance of any doubt, street vending of food and beverages and all retail food services, including restaurants, in-house dining, delivery and takeaway services, have been prohibited and are now restricted until the 30th of April. I draw a specific reference here in particular to the delivery of food services. Unfortunately, this also includes catering services. So the retail of food services, all food services, cooked food in particular, we're referring to here, delivery, takeaway, that is prohibited from today until the 30th of April. This does not capture groceries that are delivering groceries to persons and the curbside pickup of groceries. They are accepted, so discount stores, markets, supermarkets, fruit stalls, vegetable stalls, bakeries and parlors who are open for the provision of food or other necessities of life will not be required at this stage to close for operations. So they continue as is normal. It is the retail food services, including caterers who may have been delivering before, you are now required to be closed during this period. With respect to the time frames that we've introduced, hardware stores, including electrical and plumbing establishments, shall only be open for sale to the public from 8 a.m. to 12 p.m. from Mondays to Saturdays. So on Sundays they will be closed. Hardwares will be only open from 8 a.m. to 12 noon on a daily basis, excluding a Sunday. The retail services such as discount stores, like a Price Mart for example, markets, supermarkets, fruit stalls or shops, vegetable stalls, bakeries and parlors for the provision of food or other necessities of life shall only be open for sales to the public until 6 p.m. on a daily basis. So we're asking all of these stores, according to the regulations, to please close by 6 p.m. to members of the public on a daily basis. Wholesale stores for the provision of food, medicine, or other necessities of life. These are the wholesale distributors of the various items, including our local manufacturers who may be making food, beverages, pharmaceuticals. We are asking you to stop your distribution operations by 4 p.m. on a daily basis. We feel satisfied that you will be able to work out the logistics, perhaps to start for your deliveries at 4 o'clock in the morning, or maybe even a bit earlier, but to close your deliveries, stop your deliveries by 4 p.m. on a daily basis. Lastly, pharmacies shall only be open for sales to the public until 8 p.m. on a daily basis. Members of the public, please, the police have been given their instructions. They will be enforcing this law. But we're asking all persons to be socially and personally responsible. Please follow these regulations. If you are out on absolutely necessary business, please avoid the social gatherings. Ensure that you socially distance. Some of these businesses will be putting out their own advisories, so they may reduce their own opening hours. That is a decision for them. But we've regulated with these opening hours, and we continue to please ask you to listen to what our medical experts are telling us at this time. There's one last thing that I'd like to announce. Forms that are being distributed by the Ministry of Finance for the salary relief, as well as certain forms that are to be distributed by the Ministry of Social Development and Family Services. They have requested of the Trinidad and Tobago Police Service to set up distribution points for these forms at police stations throughout Trinidad and Tobago, and that has been agreed to. It is not foreseen that there will be any interaction with the police because we don't want disturbance, but simply these forms would be hopefully outside of the police stations in pre-set up arrangements, and members of the public can just go collect a form and leave the police stations. These forms will become available towards the end of this week. Thank you very much, Minister Cox.
Thank you very much, Minister. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. I recognize Anna Ramdas, Express.
Hi, good morning.
Morning,
Morning.
Good morning.
I have two questions, but question one has several parts. It's about the private labs. Minister Dial saying, how many private labs are there in Trinidad and Tobago with testing capabilities? Do we anticipate a rise in number of cases with the partnership of the private labs? How is the ministry going to control exploitation of prices? And lastly, what is a reasonable cost for a test at a private lab? And my second question has to deal with the Cuban nurses. Has a date been confirmed with respect to their arrival? And will they be paid by the government of Trinidad and Tobago or the Cuban government?
Okay, thank you, Anna. Let's see if we could answer some of your questions. As to the number of private labs, I would not have that detail off the top of my head. It is something I can get. Is it that we expect a rise in number of cases? The answer is possibly yes. All these measures are being taken to suppress the number of cases. So what we want coming out of the partnership is not necessarily number of cases, but numbers of tests. As to the costs, I cannot give you a cost as to what is reasonable, but I could tell you one private lab was charging between $1,000 and $2,000 to do a whole panel of tests, including COVID. In the United States, if you don't have insurance, you have to pay $1,000 US. Our people don't have to pay that via CARFA. I could also tell you United Kingdom, it was being touted that to get a test done privately was £485. So that will give you some idea of how the price of tests go. But in Trinidad and Tobago, private labs free enterprise, capitalist society, but we just ask all private labs to price your services reasonably. What we want is a national effort to save our way of life and to save lives. Thank you very much.
Thank you very much. Anna, are you okay? I think there's another part of the question.
I can help with that question. I've been assisting the Ministry of Health with respect to the getting of the Cuban nurses here. So what is happening is the Cuban government is making the necessary arrangements to have a Cuban plane bring these nurses here. And those arrangements are currently being put in place, and I hope that we would be able to complete it and get these Cuban nurses here, medical personnel here within the next couple of days. They will be quarantined for the 14-day period, and once at the end of that 14-day period they're healthy and have not shown any signs or been positive for COVID-19, they will then be allowed to enter our healthcare system.
Are we through?
Yes,
That's it?
Thank you.
Okay, but before I take a question from the panel, I want to ask Minister Young this is a question online from Eastport of Spain, and the person is saying that there are a lot of children still outside, unattended to.
Correct.
What are we going to do about that?
All right, so thank you very much, Minister Cox. We've been getting reports that in certain neighborhoods, certain communities, parents are allowing their children, and I guess to an extent understandably, because the children, they don't want to keep their children indoors, but they're allowing their children to be outdoors and congregating in large numbers and to be moving around. This, of course, goes completely against the advice of the Ministry of Health and our medical healthcare experts. We're asking parents, as best as you can, please have the children stay at home. Understand that in these various playgrounds and these areas, they're not going to be properly sanitized. And having your children, nobody, as we've heard over the past few weeks from our medical experts, nobody is immune to the spread of COVID-19. And having your children in these instances, socializing, mixing, mingling, liming, playing together, there is the possibility they will then bring it back into the household, where I'm certain we will have some elderly and other more vulnerable persons. So please, parents, as difficult as it is, we're asking you, please be more responsible and try your best not to have your children outdoors in those gatherings and mingling. Thank you very much, Minister Cox.
Thank you. Mark Basant, CNC3.
Hi, good morning to the panel.
Morning.
I'm just trying to follow up on Anna's question. How does it work? If a patient pays at a private lab, isn't that patient supposed to get that result because he has paid his money? Or is it going to be some form of time lapse before you tell the patient whether they are positive or negative, as the case may be? Secondly, what is the exact reason for the delay in the PCR testing at Mount Hope coming on stream? Is it a delay in having the correctly laid out space, a delay in getting the right technicians? Because initially you had said that you had forecast the lab would be ready a few days after you announced it, and it's now been a week and a half.
So,
thirdly, can you tell me how many health workers are in quarantine and how many have tested positive if so for the COVID-19, and how many people have died in the ill-fated cruise that came back of the 8 that we have so far?
Mark, just repeat your 4 questions, please. I think the CMO might answer the first part. I will deal with North Central, and then the CMO will deal with deaths. So, we were hoping to have...
Let him repeat his question.
Yeah, sorry. Just repeat them.
I'm following up firstly on Anna's question. You have a patient going to a private lab to, of course, pay for a service to get tested for COVID-19.
Good.
Saying that those results must first be sent to CAP. But I, as a patient or somebody else that goes in there and not, when is the time lapse for you to be given that result?
So the CMO will answer that one. 2, I will answer the one on North Central RHA. The third question was what, Mark?
The third question is how many health workers have been placed in quarantine? I know that yesterday.
So the CMO will take that one. And the fourth question is?
How many people of the 8 deaths that we have so far aside from the crew?
So again, the CMO will take that. So let me deal with North Central RHA. yes, we had a delay in getting North Central up. It had to do with the fact that the kits that we got in for testing, it's a two-part process. One, you must have the test, but you must also have something called an extraction kit. The extraction kit extracts the DNA from the sample. What we have are the kits. We are now trying to get, they came in without the extraction kits. So we are now sourcing extraction kits. Once the extraction kits are in the country, then we could ramp up. That is the only key back right now. That is the extraction kits. We have to realize that international supply chains have been disrupted. The key back is trying to get a cargo plane to bring in a very lightweight, small item for that. So that is where the key back is, because international flights have been disrupted. So now the CMO will deal with parts 1, 3, and 4.
Okay, so the question related to the testing. So someone goes to a private lab and gets a positive test. What has been happening for some of them that we know of is they're actually sending the positive test onwards to CAFA, and CAFA is now repeating that test to ensure that it's a valid result. So we have had 3 instances that we had patients getting COVID positive results at private labs, and on those 3 instances, they all turned out to be negative when we did the PCR at CAFA. So it shows at this point, we don't have any validated private labs that we are recommending to actually go to have a test. So although we are asking private labs to be, and Minister had said that we're asking them to be validated before they offer these tests for sale. And more concerning is that they may have had people that would have gone to a private lab, got a negative test, feeling safe and go about your normal life. You feel maybe that you had a normal cold and you're mingling with the rest of the population, and then we saw in the graphic how that can cause an alarming rate of spread. So for now, there's no validated labs. We are asking labs to actually reach out to CAFA. They can reach out through the Ministry of Health as well, so that we can validate your testing. Once you have validated, then we have confidence in you that you can put out an appropriate result. The length of time CAFA would have taken for turnaround is generally 24 to 48 hours. And of course, I can't speak to the private labs as to how long they are taking to do their PCR testing, but generally speaking, 24 to 48 hours to get a lab result back. Those lab results are then sent to the lab managers of the hospitals throughout Trinidad and disseminated to the physicians. So patients generally don't get the result. Usually the result is sent to the physicians. The physicians need to let you know what the result is and counsel you appropriately when they do so. In terms of your third question, you had asked about healthcare workers being infected. There would have been, I think, 2 persons thus far, one in Tobago, one in Trinidad. And your final question related to number of deaths. We have a total number of deaths as 8. I don't want to narrow down as the number of deaths from that particular group, because I think it is, again, releasing a little bit too much information. I don't want to stigmatize that group in particular any further.
Thank you very much, Doctor. ACP News, next.
Hi, good morning, Private Harry, ACP News.
Good morning.
I have a question each for Minister Young and one for Minister Dialsing. Minister Young, I just wanted to get the latest with the Trinidadian nationals in Barbados, Venezuela, and Suriname. I've been in contact with those in Suriname, and they're saying now that there are at least 42 of them who are in Suriname, and some of them work actually in the gold mines there. They want to return home, but no one has contacted them as yet. They are asking if you can provide them with somebody that they can contact, because they have gone to the Trinidad Embassy and they are not getting any sort of information there. That is the question for Minister Young. Shall I ask Minister Dialsing the other question?
Sure.
One. Minister Dialsing, now people are at home more than usual. People are at home with their spouses, with their children, and sometimes tensions may run high. Is there any policy or any sort of help in terms of counseling that these people can get? And also the parents who have children who are writing SEA, who are writing CSEC and CAPE, because sometimes the stress sometimes is more on the parent, especially in the SEA. Is there any sort of counseling or any place or any system the ministry has that could assist these people?
Thank you very much, Prior. Two good questions. The issue of people being in close quarters for 24 hours a day, when prior to that they would have been out working. So, you know, relationships are going to be different. The dynamics in the home are going to be different. Via the decentralization of mental health, which we started last year, there are mental health clinics across the country that have stepped up to the plate to help with this same issue. I think we had addressed this last week, but it's worth repeating. So under the decentralization of mental health, there will be clinics. I will also endeavor to bring, and I had her on one TV station already, Dr. Hazel Othello, who is leading this charge. She is the newly installed director of mental health, and they have put out guidelines. I think in the Trinidad Express this morning, there are serious guidelines by Dr. Hazel Othello to treat with that same issue prior. So I want to thank you for raising that question, and the advice is out there this morning in the Express. On the issue of SEA, CSEC and CAPE, I think the best agency or person to address that will be the Honorable Minister of Education, Anthony Garcia, through his student support services and so on. Thank you very much.
Thank you very much.
Minister Cox. To answer the first question posed by Prior, as you are seeing across the world, and as we've been seeing for quite some time now, the safest place for persons to be is exactly where they are and to avoid certain international travel. To address the direct issues that you've raised, with the persons in Barbados, we are sending a diplomatic note to Barbados government today, asking them, as I have provided, and I had provided immediately when our nationals went into quarantine in Barbados, we provided COVID testing cases. Thankfully, our 35, the number keeps switching. The lawyers wrote me and told me 33, then I hear 35. We provided the test kits to the government of Barbados for them to be tested. Their mandatory quarantine in Barbados is now over. We're asking the Barbadian government to please test our nationals, and I'm hoping that they all come back negative. This will be driven by the advice from our medical experts as to what are the next steps. The worst thing that can happen is they then go, if I hope they test negative coming out of their mandatory quarantine, and they re-engage with persons in public or persons who may have the COVID virus, and then they can be contaminated all over again. So that is what's going on with our persons in Barbados. We are making the arrangements with the government of Barbados to have them tested. We did provide the necessary test kits out of our supply. With respect to those in Suriname, you are now increasing the number. Again, I've been liaising with lawyers on behalf of initially one individual from Trinidad who is in Suriname. They then took the number up to, I believe, 33 as well. They have provided me with the addresses of these persons in Suriname. Over the weekend, I was in contact personally with my colleague, the Minister of Justice and Minister of National Security in Suriname, for us to make the necessary arrangements to have our nationals there medically examined. The Minister of Foreign and CARICOM Affairs, Senator Moses, has also been in contact with the Minister of Foreign Affairs from Suriname. You have to understand that in these countries, they too are dealing with their own COVID responses. So they are willing to assist us and to help us, and we are giving those matters priority, and we will continue to do so. With respect to the ones in Venezuela and Margarita, some people sent me yesterday an interesting article in the Express newspaper about 4 persons who found their way down there. I did not peruse in detail the article, but found, I believe, themselves down there. We have an embassy in Caracas, and we're asking them to please contact our embassy in Caracas, which is working, so that we know you're safe and we know what is happening. All of these countries that I've referred to have now shut their borders as well. All of these countries I've referred to are not really allowing domestic flights and other flights to leave, but arrangements may be made. The main point is, and government of Jamaica has been at the forefront along with us in this, stay in place is what they're asking certain people to do. We really want our citizens and our nationals to stay safe. With those various ones that I've just addressed, we are in contact through either lawyers or other persons, and we are making the arrangements to have them tested. The 14-day quarantine period is an important one, and even if, when they get back, the CMO and his staff under the Ministry of Health will then decide what we do with respect to quarantining in Trinidad and Tobago, having learned from what we saw from the Guadeloupe cruise. Thank you very much, Minister Cox.
Thank you very much. I recognize News Source.
Good morning. Am I being heard? Good morning to the panel.
Yes, yes.
Good morning.
Good morning.
Okay, all right. So just to make it clear that it's Rhoda Barrett who's asking these questions on behalf of my own platform. So I have questions for the CMO, for the Minister of National Security, and for the Minister of Health. I would like to know, with respect to the labs and lab testing, I'm hearing about lab validation. Who or what entity has to ensure that the labs are validated? And will there be any sort of indication, a list being put up about iterating the validated labs so that people know who are the best labs to go to? And that's for the Minister of Health.
Yes.
For the Minister of... Okay, should I pause or do I continue with the question?
Just continue. Give us all the questions.
Right, good. For the CMO, I was wondering whether the persons at Balandra who are to be decanted, if there are no new symptoms, are they being decanted to another convalescent home, or will they be allowed to go to their private homes thereafter? And are there guidelines or criteria that they will need to follow if that happens? And for the Minister of National Security, having observed what has happened here in Trinidad and Tobago, what has happened regionally and globally, it appears to be that there is some sort of provisional plan with multiple stages and steps, right? And of course, if we hit particular levels, then we move on to a different degree of intensity. What is likely to be the next stage, and what are the things that could push us over into that next stage, please?
Okay, so thank you for the questions. So I will take the first one to deal with labs. CARFA is the entity that will validate labs. And yes, as the validation comes on, we will let the public know by advertisement or public pronouncements which labs have been validated by CARFA, and they can go to get their tests done. I will let the CMO answer his part, and then Minister Young.
Right, so in terms of the 22 remaining persons at Balandra, they would have had their last negative test on the 26th, I believe, of March. So basically those people, the 22 people, never had any symptoms of any kind. They would have had negative tests already. Once they crossed the 14-day threshold, which is coming up soon, it means that post their last exposure, they would have had 14 days with no symptoms. We are not going to decant them to another facility. They will be allowed home. But we are still being guided, because as we have seen in other countries, they're out of an abundance of caution that they still self-isolate, they stay home for an additional maybe 7 days, just to ensure there's no other possibility of symptomatology occurring. But they will be allowed home once they cross their 14-day period into day 15 without any additional symptoms.
Thank you very much, Minister Cox. With respect to the last question that was asked, as we've said consistently, this is a very fluid situation. There is absolutely no checklist that any country in the world can follow directly in line and say, okay, this is the next step, this is the next step. Every country is experiencing its own set of symptoms, its own set of circumstances, rather. That's the word that I'm looking for. We will continue here in Trinidad and Tobago to be guided by our medical experts who have done an excellent job so far in providing their advice on a very timely basis. We are monitoring what is going on in other jurisdictions in the world, sometimes more actively than just what you see in the media and on the newspapers, by actual intervention and conversations with those who are dealing with this in some jurisdictions, that it has crossed that line and that the spread has just taken off and their hospitals are under strain. So these are the things that will continue to guide us. What we're doing is, of course, asking persons to stay at home. We're asking persons to listen to what it is or regulations are trying to achieve and to really abide by it, we will continue in this very fluid situation to make the decisions as guided by our medical experts and to do what we continue to believe is right for Trinidad and Tobago. And I think Trinidad and Tobago can take some measure of relief in that we are following our medical experts and we have done certain interventions a lot sooner than other jurisdictions, and we seem to be in a okay place for now, but that can change very rapidly, which is why we continue to take measures as we go along. So there is no checklist, there is no magic circumstance that's going to take us anywhere. We just continue to monitor and be guided by our medical experts in Trinidad and abroad.
Thank you very much. Minister of Health, there's a question online about someone wants to know what step up and step down means.
Okay. In treating with COVID, you're going to have different levels of care based on the CMO will come in afterwards to explain the symptomology. Starting with the most basic level of care, these are people who may be symptomatic, otherwise well, otherwise physically well, that don't need a hospital type setting for care. That will be a facility that we have dedicated up at Cora. So you are well, you don't need to be on a ventilator, you don't need to be on drips, you don't need to be on oxygen, anything like that. If you become worse, then you may need a secondary type facility. That is, you may need some type of supportive care. Then if you decompensate even further, you may need tertiary care. You may need to go on a ventilator and ICU. Then the reverse happens. As you start to recover, you can move from an ICU back into an open ward. As you improve, you move from an open ward into a more convalescent system where you are now able to walk around, life goes on as usual. So that is the levels of care. The CMO can go into some more detail, and we have all three levels of care: convalescent, primary, secondary, tertiary.
Okay.
Dr. Parasram?
Yes, so I think the minister did a good job, but
thank you.
Just to add, in terms of the only thing that differentiates when we go into convalescent care, we're talking about people that have recovered and basically have no major medical illnesses, so asymptomatic period. So people already had their symptoms, you were in a hospital for some length of time, received treatment, now you have no symptoms at all, so you're asymptomatic, basically you're well. If you did not have an infectious disease, at that point you would have been allowed to go home. So we have a large number of people growing as people recover that fall within this category, that you're well, no symptoms, you don't need medical intervention. But what we're waiting for is for you to achieve the discharge criteria. As we described before, getting your negative test before you can go home to ensure that there's no further spread to the population. So we are in the process, as you have seen, we have already moved 17 people a couple of days ago out of Hoover. Those people would have been asymptomatic awaiting their negative test to be discharged. And again, we're going to do 15 persons in short order. And it will continue. As people recover, we will continue getting them into convalescent areas, which are not specialized hospitals. They are more dormitory-like facilities that they can stay and be a little more free than if they were in a hospital environment. And then we await their negatives in those settings.
And I think a further explanation, if you could put back up the graphic. When we want to discharge people, we want to discharge people who are clinically free of the virus, so that that person on the top who may be discharged does not start up his own pyramid again. All this is to protect the population, because anyone can start up their own pyramid and then crash the whole healthcare system. So as you get well, you step down, you meet the discharge criteria, you go home, but then you isolate for a further 7 days out of an abundance of caution, so that we don't get new pyramids starting up all over the country. Thank you very much.
Thank you. IETV? We're not hearing you. IETV?
Hi, good morning, everyone.
Good
morning.
morning.
All right, I have two quick questions.
Your name,
the first
please?
one is, oh, sorry, Bina Mahir, some IETV News.
Thank you.
Morning, Bina.
Okay, morning. I have two questions. The first one will be for the Health Minister. Minister, can you update us whether or not all medical staff are facilitated with PPE? We've had reports that some nurses at the Accident and Emergency Department, for example, at the Eric Williams Medical Sciences Complex, they expressed concerns that patients are coming in with symptoms, some with no symptoms at all, some with basic pain, and they're saying that they don't even have PPE to wear to test those patients or to interact with those patients. And the second question is for the Minister of National Security, Minister Stuart Young. Can you kindly update us on border control, meaning do you have any recent reports of illegal entries, especially in South Trinidad, since the COVID pandemic is happening? Thank you.
Okay, thank you, Bina. I think that's a very good question. So, PPE is a hot topic around the world, again, because global supply chains have been affected. Many countries don't have PPE or don't have enough. We don't have that situation in Trinidad and Tobago. But to prevent that, as the Chief Medical Officer will explain the details, we have a policy in Trinidad and Tobago to make PPE at the various levels available to all frontline healthcare workers when required based on protocol. And I would like to quote from a Newsday article, page 8, Sunday, April 5th, 2020, which I have here. And this is a healthcare professional speaking. This is not me speaking. This is a healthcare professional speaking. She said she felt safe and comfortable dealing with the patients because all the medical professionals had proper personal protective equipment, some of which was better than in some hospitals in the US and the UK. The issue of who gets what grade of PPE, as the Chief Medical Officer will now explain, depends on their level of exposure. So, not all 17,000 healthcare workers will get an N95 mask. It depends on their level of exposure, what type of procedure they are doing. All frontline healthcare workers in accident and emergency or anywhere have the appropriate PPE. What we have done to manage our stock and to make sure we do not run out and to make sure all healthcare professionals have access to PPE is that the chief executive officers of all RHAs are now in direct control of the giving out of PPE, so that when there's a need for PPE in any particular setting, the chief executive officer now has direct control of PPE. As I said about 2 weeks ago, to manage this PPE issue and to protect healthcare workers, we have a second strategic stock of PPE at the Ministry of Health. So, PPE is given out on a daily basis to all healthcare service points, depending on current need. The facilities that need a higher degree of PPE based on exposure, which the Chief Medical Officer will now explain, they have access to more PPE. So over to you, Chief Medical Officer.
Okay, so let me start from the beginning. So I think it's broader than PPE. It is what we have put in place in the system to protect our healthcare workers in general. So starting before we had our first case, we had one instituted in all our major institutions, the accident and emergencies, the health centers, the DHFs, the enhanced health centers, a parallel system of triage. So triage is basically where the patient contacts the system in the first place. So what we did is we set up separate waiting areas for persons with any sort of flu-like illness. Those staff within that area would ask a series of questions to determine whether you have a possibility of being COVID positive or another illness. The persons within those areas actually were asked to wear PPE, were given PPE and asked to wear it as well. So that's our first line as they were coming in. In terms of our levels of PPE within the A&Es, as well as the various units, there's varying levels, and that is guided by the healthcare worker policy and the PPE policy, which is a WHO document that we have tailored to our use. Our microbiologists are key in every hospital to lead the training, which has been ongoing throughout, as to which level of staff needs which type of PPE, and they have been doing so and giving to the appropriate level different levels. For instance, someone that needs to take a sample, a nasopharyngeal swab, they will be wearing N95. Somebody that works in an emergency department and contacts with critically ill patients, they should be wearing an N95. Someone in an outpatient clinic can use a surgical mask in those instances. So there are varying levels of protection we have afforded the healthcare workers. The other system, and Minister would have spoken about it before, is really creating a parallel health system. So basically, we are not treating COVID positive patients in any of our main institutions, which we have seen happen in other parts of the world, where they are treating COVID positive patients within their general hospitals. There have been rampant nosocomial spread within those hospitals to healthcare workers and to other patients. And we are trying our utmost best to keep the COVID patients treated in CUVA and CORA and any other facility that we identify as separate and parallel to the main system to ensure healthcare workers are protected and the patients seeking other levels of care.
To answer that second question very briefly, Minister Cox, the answer is that at National Security, we continue to be very aware of our maritime borders. Our radar system is working. It has been upgraded. Our Coast Guard is working along with the Trinidad and Tobago Police Service. I alluded a little earlier in one of my answers to the fact that what is actually happening is we're having Trinidadians now take their vessels and go across to Venezuela. So after a sting operation over the weekend, some of them were charged for breaching this regulation and breaking our borders. There is not the number of Venezuelans coming across, because right now in Venezuela there's a complete lockdown, and I think they understand in Venezuela, is what I'm told by our intelligence, that the best place for them to stay right now is right there in Venezuela. So we're not seeing that influx despite what people may be saying, but there are Trinidadians who are going across to try and start a trade. We will prosecute them, we will charge them. If I may allow, very, very briefly, with respect to domestic violence, Minister Webster Roy has asked us to remind that children who may be facing abuse, please call 996 or 800-2014, 800-2014, and persons who unfortunately may be victims of domestic violence to call our National Domestic Violence Hotline at 800-SAVE, 800-SAVE, which is 7283. Thank you, Minister Cox.
Oh, thank you very much. Vern, 91.9.
Hello, morning.
Good morning.
Right, good. Vern Extavo, 91.9 from Tobago. Minister, I was very happy to hear you start with some conversation about Tobago. So my questions are going to be mainly in that particular direction. Is there any headway in terms of getting testing done in Tobago, especially at the public facilities? Have we sourced a machine for Tobago? Also, we would like to get an update on the contact tracing. When the map was revealed, we didn't see a contact tracing map for Tobago.
Yes, there was one. Yeah.
There was?
Yes.
All right, okay. So if we could just get some highlights in that particular.
Sure.
And for the Minister of National Security, does the police currently have a manhunt underway for people who have fled quarantine facilities? There are some pictures and stuff circulating on social media indicating that. And also, if you could identify what is the charge for breaches of these new updates that were given yesterday by the Prime Minister.
Okay. So let me start off with the parts of the question that are relevant to us. Yes, when we did the contact tracing map, there was a huge big map for Trinidad, and there was a smaller window for Tobago. So we are tracing in both Trinidad and Tobago. The Chief Medical Officer would have spoken to the issue of testing in Tobago, so he could repeat what he said, I believe, last week.
So in terms of testing for Tobago, we have arrangements, as I said, through CARFA, and their samples are fewer than we have right now. They would also be looked at once we get North Central up and running. to have their samples sent to North Central rather than CAFA, so we can give them priority if need be and deal with their samples quickly. Right now with CAFA, which is an international lab, it is a little more difficult, but their samples continue to go to CAFA for now. But they would be treated within North Central's facility. The County Medical Officer of Health has assured me that she is looking into the availability of a PCR machine in Tobago as well. If they don't have a machine, one can be actually sent from Trinidad to Tobago, and then thereafter we do the training and the requisite, give them the reagents and requisite test kits to do testing on their own if and when they require it.
Okay, just to jump quickly into answering those questions from Vernon Tobago. With respect to a manhunt for persons who have fled quarantine, we had one incident, I believe it was yesterday, a person who decided to abscond. Very quickly, the defense force, which were the personnel who were guarding that facility, in addition to the private security, located the individual and brought him back to the facility. Apart from that, there was only one other that I am aware of, and I am not sure what has happened with that. But of course, what we're asking persons, if the medical healthcare experts see it fit to bring you to these facilities, stay at the facilities, because exactly what Minister Dayal Singh has been showing us with that chart there today, you are considered more at risk and a potential danger to society. So when you leave these medical facilities and go out there, you're putting all of us in the population at risk. With respect to the charges, the breaches of these regulations can incur, if you're charged by the police and convicted, $50,000 and up to 6 months imprisonment. So six months imprisonment and a fine of $50,000.
Thank you. Well, while we're on Tobago, another question came in to the Minister of Health. Will any Cuban nurses be assigned to Tobago, and if yes, how many?
Okay, thank you. Let me just go back. This is a national effort. Trinidad and Tobago is one country under God. It's a national effort. As the Minister of Health of Trinidad and Tobago, resources will be allocated to any of the RHAs depending on their needs. If Tobago has a particular need for more nurses, whether they are from Trinidad and Tobago or Cuba, they will receive their resources. At this point in time, I cannot say how many of the Cubans will be going to Tobago. Once the Secretary of Health, or Dr. Tiffany Hoyt, alerts us to a resource gap in Tobago, the same way that the CEO, Medical Chief of Staff in Southwest, alerts us to a resource gap in Port of Spain, in Sangre Grande, or in Mount Hope. Any resource gap across the 5 RHAs will be dealt with centrally from the Ministry of Health. There will be equity in treatment for all the RHAs depending on their needs, their burden of cases, and any resource gap that they have identified. Thank you.
Thank you very much. There's a question to the Minister of National Security with regards to social services. If religious institutions, if they are considered social workers, like religious heads.
Okay. At this stage, Minister Cox, the answer is when we drafted that specific provision, social workers and workers who provide social welfare support and non-governmental organizations that work with the socially disadvantaged and vulnerable, we wanted to keep it as broad as possible because we recognize that our vulnerable in society are going to need help. So at this stage, the answer would be yes. But we're asking persons to really be out there doing your social distribution, but being aware that this is a contact virus. So you need to find ways, and I've been looking at international news and seeing how people are distributing by leaving packages. Work it out, bearing in mind that the most important thing is for us to try and prevent the spread of these viruses. Minister Cox, there was also one question that came up yesterday and today, that is with respect to the convenience stores at gas stations.
Yes, I saw that online.
Yeah, yes, briefly address that. Convenience stores at gas stations, most of them have spirit grocers licenses, so you are required. We're asking these convenience stores to be closed at 6 p.m. just like groceries, supermarkets, bakeries, and other stores. Otherwise, we'd be defeating what we're trying to achieve. So 6 p.m. time applies to these convenience stores at gas stations. Of course, the sale of fuel, gas to cars, vehicles, etc. can continue.
Thank you very much. Thank you very much, Minister. TV6.
Good morning, Renessa Cutting, TV6
Morning,
News.
Renessa.
Good morning.
Good morning.
Morning. There's a video circulating of a sanitization exercise at a lab reportedly at the Port of Spain General Hospital. And we're being told that the entire crew has been quarantined as well, and this could have ripple effects in terms of persons getting their results and things like that. So I'd like to get a confirmation or denial of this space.
So, Chief Medical Officer, if you want to take that, please.
So, in terms of the lab at Port of Spain, the lab at Port of Spain is not the lab that does any COVID testing. To start with, that lab is the Caribbean Public Health Agency, which is off-site in Federation Park. So that is not the Port of Spain General Hospital lab. Just for clarity, in terms of patient disclosure, I mean, I would not, in the past, and I would not want to say where any of our positive patients are at this point. So I think we need to, in that light, I don't want to go further with that query.
Okay, thank you. Guardian Media Limited. Oh, I think, hold on. TV6, you had a follow-up question?
And please to ensure that operations continue.
Please start over. We didn't hear you from the beginning.
I wanted to get a sense of exactly what that lab does and what systems are in place to ensure that operations continue there. And I also have a second question where it concerns healthcare workers, particularly those who attend to the confirmed patients, the confirmed cases. What is the protocol with regard to these persons returning home to their families and or interfacing with the general public?
Okay, so the Chief Medical Officer has all those details, and he will give it to you.
Yeah, so in terms of the second question, first, there's a healthcare workers policy that determines your level of risk, level of exposure based on the PPE that you wear, which is disseminated through all the RHAs, and they are the people that will be guiding, together with the county medical officers of health, how long you stay away, what is your level of exposure, whether it's low, medium, or high, whether you are allowed to go home to your family or you're staying at a state facility. So that is clearly laid out in the healthcare workers policy. The other part of the question, in terms of business continuity, and we have had that discussion from the start, with all the CEOs having the mandate to have business continuity plans for every department in the hospital, whether it be in a sewing room, whatever it may be, they have to have a secondary team. So what we have been asking them to do is have some sort of rotational policy in the event, especially with the clinicians, in the event that a group of people get infected, there are another group of people that are uninfected that can take up the shift. So that's the way we have been dealing with the continuity. There's also use of private sector for labs and radiology departments, for example. If we cannot continue in any particular hospital, they can either use the private sector labs, they can use the private sector radiology departments, they can use the radiology departments or labs of other hospitals as well. So there are a lot of contingency plans in place in the event that one particular service goes down throughout the sector.
Okay, we move to Guardian Media Limited. Peter Christopher.
Hi, good morning. Good morning, ministers.
Good morning,
I noted that at the start of the press conferences, you were wearing your masks and such. I just wanted to get an update concerning the mass distribution program that was announced yesterday. When will that come on stream, and what areas the mass distributions will take place? I also have a question for the CMO with regard to the epidemiological review. You said that there were 2 cases that were still under review. Has there been any update with regard to that? And a final question with regard to the catering. I know you mentioned that caterers would not be allowed to provide food during this time, but there were some medical institutions, I understand, that did receive food from catering services. Will that still be continuing, or will there be an alternative arrangement made for those workers?
Okay, Peter, so I'll thank you for your question. So I'll take the issue about masks first. So I have with me here 2 types of masks: homemade masks and a good old N95 masks. What we are asking the people to wear are homemade masks. You can make your own mask at home with fabric, elastic. We will be partnering with private sector to get a couple 100,000 units of homemade masks that they make distributed. The channels of distribution will be members of parliament. I spoke with Minister Kazim Hussein yesterday, and I indicated yesterday we'll be using local government. He reassured me that his disaster management units at all the 14 corporations in Trinidad and via TAJ in Tobago, they are ready, primed, willing to help us with mass distribution. We will be also connecting with one or two NGOs to help us with this. So we hope to start up mask distribution as early as later this week, once we get the supplies in from all of those who are making masks for us from the private sector. However, people can make their own simple masks at home. Simple fabric, 2 pieces of elastic, and you're good to go. In addition, as the Chief Medical Officer said, a simple bandana wrapped twice is an excellent mask until you get from us. So it's both a partnership with the Ministry of Health, individuals who can sew, NGOs, private sector. We can start. Well, I've already seen people wearing masks in huge numbers coming into Port of Spain this morning, and that's a good thing. So we can all rely on each other for the distribution of masks.
Just to answer the question very quickly on the catering issue, there are going to be some frontline essential services that will still be permitted the opportunity to receive catering. So, for example, our prison service, the medical health workers and services. But please understand the policy. The policy, what we're trying to do is get people to stay at home. So it is not, if we allow delivery and catering delivery, everybody. We have private sector workers asking if they can still have their catering services. As you heard the Prime Minister say yesterday, now is the time when, in unusual circumstances, everybody make your lunch, take your lunch to work. There will be a limited number of exceptions because our frontline workers, especially our healthcare workers or policemen or defense force, prisons and some of these on the front line, they are required to have all of their effort put in, and they will not have the opportunities like the rest of us to make our own food. But there will be very, 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 very limited exceptions to this rule. Some old people's homes have been reaching out as well. That is something after consideration with the Chief Medical Officer and the Minister of Health we will give consideration to. But please don't flood us with requests for exemptions for catering, because we're not going to allow it.
Let me just say one more thing on masks, because Peter, you raise a very important point. I don't want the public to get the impression that wearing a mask now means we drop our guard. And that is what I fear about people thinking that wearing this mask now offers you total protection. This is one of the measures. It doesn't mean that if you wear a mask, you now go around and jog around the savannah. It doesn't mean that. It doesn't mean you wear a mask, you now go on Lime on the Brian Lara Promenade, or Harris Promenade, or in Scarborough, Tobago. It doesn't mean that. This mask is to be used when you have to venture out in the public domain for essential goods and services. So you go into the pharmacy, you wear a mask. You go in to buy food, you wear a mask. You go into the doctor, you wear a mask. My fear is that people will drop their guard thinking that I am wearing a mask, I could go out into the public domain as I see fit. I need to have that message loud and clear. Wearing a mask is not an excuse or reason for us to drop our guards. The simple message is stay home.
Thank you very much, Minister. Members of the media, so sorry to say that that is the last question we have time for. But before we go, let us go to the Minister of Health, the Honorable Terence Dial Singh, for his closing statement.
Thank you very much. And if we could put up the graphic again, because this is a very important graphic that I would like to burn into our collective consciousness. That graphic, ladies and gentlemen, don't be the start of your own pyramid of infections. Don't be that person at the top. Be a superhero for your family. Be a superhero for society. Keep them safe. Keep us safe. Keep healthcare workers safe. And I promise you, together, in a spirit of solidarity and discipline, we can and will be responsible and preserve not only our way of life, but we can preserve the lives of each of us. It is about saving lives. Don't be the start of your own pyramid. Thank you very much.
Thank you very much, ministers. And that's how we end today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. And as we say goodbye for today, we would like to say thank you to all our essential workers. And today I would like to single out the staff of the Ministry of Health, the Ministry of Communications, and TTT, who are out every day working despite the challenges we are facing at this time. On behalf of the government of Trinidad and Tobago, we are grateful. I am Donna Cox, Minister of Communications. Thank you for joining us as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.
TAJ 92.3 FM. We sound better.